Imagine trying to take a deep breath, but no matter how hard you try, it feels like there's a weight pressing on your chest. Each breath is a struggle, and a faint whistling sound escapes with every exhale. For millions of people around the world, this is what an asthma attack feels like. Asthma isn't just a minor breathing problem, it's a chronic disease that affects both children and adults, shaping how they live, work, and play. In asthma, the airways become overly sensitive to irritants, causing the smooth muscles surrounding them to tighten, the lining to swell, and mucus production to increase, all of which narrow the airways and make breathing difficult. This condition is quite common, affecting 1 in 10 people. It typically develops around age of 3, although it can appear later. In childhood, asthma is diagnosed 3 times more often in boys than in girls. The incidence is generally equal between sexes in adults. In this video, we'll explore what asthma really is, why it happens, how it's diagnosed, and most importantly, how it can be controlled so that life can be lived without fear of the next attack. Though the exact mechanism behind asthma is not fully understood, it is now believed to result from a combination of genetic and environmental factors. A predisposition to allergies plays a major role, especially sensitivities to dust mites, house dust, and animal dander. However, it is important to remember that allergies are far more common than asthma itself. Several genes appear to influence the likelihood of a person developing asthma. Having a family history of asthma further raises the risk, highlighting the hereditary component of the disease. Environmental factors also play a significant role, both in triggering asthma symptoms and possibly influencing its development during early life. Air pollution, tobacco smoke exposure, respiratory infections in childhood, and occupational irritants can contribute to airway inflammation and hyperreactivity. Yet, the exact contribution of these factors to the onset of asthma remains under investigation. Interestingly, research has shown that asthma is nearly as common in polluted urban environments as in rural areas with cleaner air, suggesting that the condition cannot be explained solely by pollution levels. The major signs of an asthma attack include shortness of breath, a wheezing sound during exhalation, and feeling of tightness in the chest. The intensity of these symptoms can vary widely, both on their own and in response to treatment. Sometimes an attack is preceded by subtle warning signs, such as itchy chin, discomfort between the shoulder blades, or even a sudden unexplained sense of dread. Frequent asthma attacks can seriously affect a person's quality of life, often causing sleep disturbances and repeated absences from work and school. Depending on the severity of symptoms, affected individuals may need to seek help from a family doctor, emergency services, or in more serious cases, may require hospitalization. When asthma is not properly treated, it can lead to long-term complications. Over time, permanent structural changes may develop in the airways, making breathing more difficult. Furthermore, prolonged use of certain asthma medications can sometimes lead to side effects, underscoring the importance of regular medical supervision and proper disease management. Many different irritants can trigger asthma attacks. In the past, doctors advised patients to avoid these triggers altogether, but the current understanding is different. An asthma attack following exposure to a known trigger is now seen as a sign of poorly controlled disease, rather than simply unavoidable sensitivity. The most important asthma triggers are allergens, especially dust mites, household dust, and animal dander. These are particularly relevant because people are exposed to them throughout the year. Pollen and mold spores cause seasonal flare-ups, but when their levels in the air get high enough, they can still trigger severe asthma attacks. Viral infections of the airways are another major cause of asthma flare-ups. The exact mechanisms behind this remain unclear. Certain medications, especially those used to treat high blood pressure or irregular heart rhythm, may also trigger or worsen symptoms. Other common triggers include physical exertion, cold air, rapid breathing, and even laughter, particularly in children. Finally, air pollution plays a significant role. High levels of pollutants such as sulfur dioxide, nitrogen oxides, and ozone are strongly linked to an increased frequency of asthma attacks. A pulmonologist, a doctor who specializes in lung diseases, manages asthma treatment. The evaluation begins with a medical history overview and physical examination. The doctor will ask about symptoms, existing health conditions, and all medications currently being used. Patients are advised to prepare a list of drugs they are currently using with exact dosages or to bring the medication packages to the appointment. If asthma is suspected, the next step involves assessing lung function. This is done through spirometry or body plethysmography, which measures how well the lungs work before and after bronchodilator medications. A chest X-ray may also be performed to rule out infections or other conditions that can provoke asthma attacks. Allergy testing helps identify sensitivities to common allergens such as dust mites, house dust, animal dander, or pollen, and determine whether these substances may be triggering asthma symptoms. Another useful diagnostic tool is the fractional exhaled nitric oxide test, or FeNO test, which measures the amount of nitric oxide in the exhaled breath. Elevated levels indicate airway inflammation, a hallmark of asthma. The FeNO test can also be used to monitor treatment effectiveness, as nitric oxide levels typically decrease when inflammation is brought under control. Asthma treatment relies on a range of medications designed to prevent asthma attacks and reduce complications. Since each patient's condition is unique, therapy is carefully tailored to individual needs. Most asthma medications are inhaled, but they can also be combined with oral or intravenous drugs when necessary. For many patients, one inhaler used daily for long-term control alongside a rescue inhaler for rapid relief during attacks is sufficient. However, some individuals may require a combination of different medications to maintain good disease control. Conveniently, there are now combination inhalers that include several active ingredients in a single device. In cases of severe asthma attacks, treatment may involve oxygen therapy, inhaled bronchodilators, and intravenous medications. In the most serious situations, patients may need to be hospitalized in an intensive care unit and placed on mechanical ventilation to support breathing. Preventing asthma attacks requires consistent use of prescribed medications and adherence to general lifestyle measures that help keep symptoms under control. To minimize exposure to triggers, it is paramount to keep your living environment clean. Regularly remove dust, use allergen-proof bedding, and avoid carpets that trap dust and mice. Eliminate mold sources in areas such as bathroom and kitchens. The air conditioner should be clean and properly maintained, as this helps reduce both pollen and humidity indoors. If you are allergic to animal dander, it is advisable to avoid contact with pets. Regular physical activity can improve lung function and overall well-being, but it is best to avoid exercising in cold air. Maintaining a healthy body weight also plays an important role in controlling asthma. By following these measures consistently alongside your prescribed therapy, you can greatly enhance asthma control and reduce the likelihood of future attacks. Asthma may be a lifelong condition, but with the right treatment and good control, it doesn't have to limit your life. Modern inhalers, regular follow-up with your doctor, and a few simple lifestyle adjustments can make all the difference. Remember, every person's asthma is unique, and learning to recognize your own triggers is the key to staying in control. With proper care, most people with asthma can lead normal, active lives. If you found this video helpful, consider subscribing to more educational content. Have a great day.